Good evening and welcome to blackdoctor.org. I'm your host this evening, Shamika Rhymes, and we're having an important conversation tonight. But first, let me know in the chat where you guys are watching from tonight and make sure that you share this with your network because you never know who may need to see it. So, March is National Kidney Month, and we're continuing the conversation in part two of our kidney awareness series. So, being diagnosed with kidney disease is life changing, and that's what we talked about in part one. But what does it really mean to live with it every single day? From adjusting to dialysis to managing medications, diet, mental health, the journey can be super overwhelming, especially in the Black community, where access to treatment and early diagnosis still remain to be challenging. I see you, San Francisco. Thank you for checking in, and Gastonia and Asheville. I see y'all. So tonight we're shifting the focus to the lived experience, what it's like to navigate life with chronic kidney disease or kidney failure. So we're going to hear firsthand about the physical, emotional, and mental impact of this disease, the realities of dialysis, and what needs to change to improve care for our Black patients. Okay. So again, if you have questions at all tonight, drop it in the chat. Let me introduce you to tonight's guest. We've got Dr. Shirley Leon. She is a physician specializing in nephrology. Hi, Dr. Leon. How are you?
I'm good. Thank you. Hello.
Thank you for joining us again. We've got Sheila Jackson. She is a patient and patient advocate. And we've got Kim Delaney, who is also a patient and patient advocate. Hi, Sheila. Hey, Kim.
Hello. Good evening.
Welcome back. You know, we heard some of your story in part one, but I hope we can hear a lot more of that tonight. So thank you all again for joining us here on Black Doctor. So Dr. Shirley, why should kidney health be a priority in the Black community?
Like we mentioned, I think 2 weeks ago, kidney disease or chronic kidney disease is a very large burden. Like 37 million people have chronic kidney disease, and that's about 7 out of 10. And a majority of them, 90%, don't know that they have kidney disease. Also, those that have hypertension and diabetes are at increased risk for kidney disease, which is, again, if you look at the landscape, it's mostly our population that's diagnosed with these conditions. So I think it's very important that we know the risks and that we understand the disease process so that we can better manage and even prevent it.
Thank you. So, for those that may not have seen part one, I know some of the questions may be a little repetitive, but what are the most common kidney diseases that affect Black individuals? Dr. Leon.
I know Sheila mentioned she has FSGS. Mm-hmm. There's IgA nephropathy. If you have lupus, you can get lupus nephritis. Let's see what else. Other, causes, HIV. Some patients with sickle cell long-term can develop kidney disease.
Yeah. And how does kidney disease affect other organs in the body?
Mm-hmm. So kidney disease also places you at risk, especially if you have end-stage renal, for increased cardiovascular disease. It affects your blood. You're not making the cells that you need, so you can be anemic. It can cause bone changes. So you have also mineral issues with your calcium, phosphorus. Yeah. It basically impacts those organs.
Okay. And you kind of mentioned this, but can untreated kidney disease lead to heart disease, stroke, or other serious health conditions?
Not lead to them. So definitely heart disease. So okay. if you have kidney disease, you likely had hypertension. So you do find, unfortunately, that some patients who've had hypertension can, have a stroke, and then while having a stroke, having that diagnosis on your, on you, also develop end-stage renal. So now you have combined conditions. But heart disease is the number one that's linked. So if you have chronic kidney disease or end-stage renal disease, you're at increased risk for heart disease. Definitely.
Okay. So let's talk treatment options before we get into Kim and Sheila's stories. But what are treatment options for kidney failure? How does dialysis work? And at what point is a transplant needed?
Okay. So end stage renal, when you get to like CKD stage 5, you are going to require dialysis. What I do when I speak to patients, especially like I tell you, so there's the ones that they crash into dialysis, meaning they're just finding out in the ER that they're about to start dialysis. In that case, it's hemodialysis. Okay, we're inserting emergency lines to get the dialysis going so that we can stabilize them. Then we have a discussion about you're going to need dialysis. So we're going to put a catheter in your chest so that we can set you up with a dialysis center where you're going to go for dialysis 3 times a week for 4 hours each session. So that's one option. Then I have patients that I'm seeing in the clinic where they're at stage 4. Then we're talking about, you need to start creating an access, which is a fistula or a graft in your arm, and that you can initiate dialysis as needed as your symptoms and clinical picture worsen. So then you have a choice as to, when you make that decision. And that would also be hemodialysis. But at the same time, when we're in the clinic, depending on a lot of different factors, you can also opt for peritoneal dialysis. And that's a different mechanism where you can do that at home. You're pretty much in control of the setup and, and in the control of that. It allows you to travel, it gives you a little bit more control of your life. Some patients were still able to work. As opposed to, hemodialysis, right? Like you have to be someplace for 4 hours and you're undergoing this treatment that like really gets you tired. It's really challenging. So hemodialysis, peritoneal dialysis, and then transplant. So transplant, I think once you're diagnosed with end stage renal, I think everyone should consider going on the transplant list. Having the diagnosis of end stage renal, when you do enter onto the transplant list, it kind of gives you a running counter. Like once you're diagnosed, you can start, the clock to be listed because there is a wait for transplants. But yeah, so I think options are hemodialysis, peritoneal dialysis, and transplant.
Okay, thank you. Sheila, let's start with you. You mentioned a few weeks ago a little bit about your story, but for those that are just tuning in, can you kind of recap that for us? And then tell us, your dialysis story and then transplant story.
Sure. So I found out I had kidney disease at the age of 17, a few weeks right after I graduated from high school. The only symptom I had was I had really swollen feet. And, my mom said, something's not right. This looks like more than you're just, retaining water, so to speak. So my father took me down to the emergency room. They did blood and urine tests. And then they said, look like she's spilling protein. There's something going on with her kidneys, and we had to keep her overnight. And we're just like, kidney disease? What are you talking about? Kind of thing. So, and then by the time, and they treated me with like, high dosage of steroids and other medications. And by the time I was 18, I had a kidney biopsy, and they told me that's when I had the FSGS. Mm-hmm. And I remember the doctor saying, okay, within 3 to 5 years, you're going to end up either on hemodialysis or needing a transplant. And so during that time, with different medications and diet modifications, I was going through college at the time. And then I got to the point where I got like really, really sick. Like I would fall asleep at the drop of a hat. I lost my appetite. Things didn't taste good. And at that point, the doctor said, okay, it's time. And so they started me on hemodialysis. I was right around 22, I believe, 21, 22, when I started hemodialysis. So yeah, it was about 5 years after I was first diagnosed. And I would go to school from like 7 a.m. to like 3 p.m. during my senior year, and then go dialyze from 4 to 7, Tuesdays, Thursdays, and Saturdays, and try to plan a wedding on top of that. And so that was pretty rough for me. Like I've had the catheter, I have grafts, I've had fistulas, I had different types of, dialysis, hemodialysis access. And so it was really tough. It was tough on me as a young person because a lot of times if I dialyzed somewhere, I was usually the youngest person in the room or in that unit. Because there were other people there who were much older than me. There were already parents, grandparents had their careers, and I felt like I was just starting, So, so I did a few years of hemodialysis, and then different people tried to get tested for me to see if they were a match to give me a kidney, and sure enough, my husband ended up being a match. So I received a kidney from him. And so I kept that kidney for 15 and a half years. And also with that kidney, I was able to give birth to our son because, getting pregnant on dialysis is like really rare and is super risky. And so I waited till a few years after my post-transplant to, try to have a child. And then it's like few years, like years later, unfortunately, my disease attacked my transplanted kidney. And so I had to start back hemodialysis, and I had the same symptoms. I was tired. I was having heart troubles. Like I was, heavy breathing just for a few steps. And then I finally took myself to the emergency room. I explained the situation. Like, I'm pretty sure my kidney is failing based on past lab results. And the nephrologist came in and said, yep, you have to start dialysis right now, like right now. And so I ended up with another catheter in my chest. I started dialysis there in the hospital. And then I think within a week, I felt 10 times better. Honestly, I walked out of the hospital because that's how sick I was. And so I did hemodialysis again in the afternoons. This time I'm working. I have a kid at home, and so it's different. I have a husband now. I have a house to take care of, and so I would dialyze in the afternoon or in the evenings, and then I end up getting a call for a transplant in Toledo, Ohio, and I went down there like 2:00 in the morning, arrived for surgery at 4, and I'll be celebrating that my second transplant this May for 4 years. So I feel like I've done the whole hemodialysis. I had first transplant, I had a baby post-transplant. I went back on hemodialysis. Now I'm on my second transplant. Hopefully it's my last. So yeah, that's like the long version of my journey.
Thank you for sharing that. And how old is I'm being nosy now. How old is your son now?
My son now is 17. He's about to graduate.
Wow.
Yes. I'm getting ready to send him off to prom and graduation and college and all that good stuff. So yes, I'm happy I'm still around to to see all this.
Yeah. Kim, can you share your journey with us?
Absolutely. My journey is completely different. Completely. So I first was sick with an autoimmune disease, which was rare enough in its own instance. So I was diagnosed with multiple myeloma and amyloidosis, which are blood illnesses. Multiple myeloma is a cancer, and amyloidosis, I call it its cousin. So you never see one without the other. They're first cousins. They're really close. And so that had attacked, and some of the symptoms were the same. Like I was super tired. I couldn't keep anything down. And I was sick for about a week before I finally went to the hospital because I was never one to go to the doctor. And so through all that, and, we found out that I did have cancer. So went through that, was my own stem cell donor recipient, that whole thing. Had my procedure at UNC Chapel Hill, and remission a couple of times, stayed in remission. But then then I got pregnant after that, like immediately after we started chemo. My doctors were terrified, and I was not. I'm a God girl, so I was like, if God ordained it, it's going to be fine. And it is. You probably heard her a second ago, eating her dinner, running through here, being loud. But So Harper is 9, and my oldest Zion, he's at school. He goes to North Carolina A&T, but he was with me through the cancer stuff. So this is his second rodeo with mom, being sick. So that kind of sucks for him. But from this, I've been able to keep. So the crazy part is my same oncologist ended up transferring from Chapel Hill to here. So he's in Charlotte now. So what I like about that is he's been with me through my whole book of care. And we have just a certain level of trust and understanding with each other. And there's 2 things I don't like to change in my history, and that's my accountant and my doctor. They know my background. I like to keep it that way. And so I was just doing my routine checkups. Even though I'm not on maintenance drugs, I do see him fairly frequently, like every 4 to 6 weeks, to just do lab work to stay on top of it because I'm not on maintenance drugs. And we noticed that my creatinine just kind of kept sticking around, being a little too high. And my blood pressure since my youngest, just would not come back down. And so it got to the point where he was like, let's just get a second opinion. Let's go see a nephrologist. And so I saw the nephrologist in his office for probably maybe 6 months. And he was like, yeah, it's bad, but I've seen worse. Like, it's not terrible. So we tried different things to help my blood pressure. We kind of messed around with different like kind of drug cocktails, so to speak. And nothing was really like changing the needle. And literally, I call it my day at Atrium. I am very involved in the community. And we had went to, I was in a leadership class, and it's all small business owners. And we had went to Atrium to meet with their division heads. And we were in the basement doing our whole education thing. And there's a spiral staircase. And I'm not a skinny girl, never have been, but I can walk without being out of breath. And we had just started chemo like a week or so before that. But because of amyloidosis, my gut is very sensitive. And so because of that, like, I changed a lot of things about my overall lifestyle once I got diagnosed the first time. And so I called him, I texted him actually, and I said, I don't feel well. I was winded just walking up the staircase. And I'm not one to complain, especially when it comes to my health. And he said, if you feel that bad, you need to go to the ER. And I felt that bad. So packed Harper up, got her some snacks because we're going to the ER. And y'all know that it's not a short trip. And they checked me in, and I felt like I couldn't breathe. Like there was like water in my lungs. And so the nurse, of course, was kind of panicking. So she had me do one regimen, and then the doctor on call immediately figured out what it was and was like, no, like, you're going to make it worse. So stop that. And that's when they told me, like, we think it's the kidneys, like it's finally kind of conked out. Needless to say, I stayed in the hospital 7 days. So like Dr. Leon said, I came out of dialysis. When I came out, the crazy part is the whole week I was there, they could not get my blood pressure down. So they were scared to put me in surgery, but I needed the surgery to get my blood pressure down. So finally, we get there. My nephrologist that had been sitting in the office, he was on call. So he came in finally, and he was like, what do you want to do? I said, sir, I don't know. Like, this is your wheelhouse. I don't know if it's going to change anything. And so they finally did the procedure, and he kept telling me, like, Sheila, I did not have your experience. He kept saying to me, you're going to feel better. You're going to feel better. I was like, you are full of crap. Like, I did not feel, I can say now I feel better. I was like, they are lying. This sucks. I don't want to be on this machine. It still sucks. I still don't want to be on the machine, but I can tell now I'm 1,000%. I can absolutely tell a difference. But then I was like, they're full of crap. This is not what it is. I do not feel any better. And so, yeah, I came out of that hospital with a tube in my stomach, and I was not happy. Still not happy, as you can tell. But
yeah. Thank you both for sharing that. Dr. Leon, how does dialysis impact a person's daily life, and what are some of the challenges that Black patients face with treatment access?
I was going to definitely go back to Kim. So, Kim, you came out with a peritoneal dialysis. That's what you opted for.
Yeah, well, I didn't really opt for it. So, sorry. So, before we got online, we were chatting. So, my veins have super small veins. And so, during my consult with nephrology, I had met with a surgeon as well, just to kind of see, like, here's our options. Here's what we do once you get to kidney failure. Because I was pretty close. I think I was hitting on stage 5 when I saw them. But they were just trying to buy me time. And so he'd already said, your veins are way too small. We're not even going to attempt to put something in. Nephrologist is probably going to be upset with us because you are supposed to have 2 lines of access. So they were already kind of prepping me to go in my stomach. And we talked about like where we're going to put it and how high and how low. And then heck, he got COVID, so he didn't even do the surgery. But
Oh.
Wow. Thanks,
yeah.
Kim. All right. And then so now to me, I would love for the people that go through the, process to discuss it first, but I can say, what
I was
see.
going to ask them after you
Yeah.
explained it a little bit.
Okay. Right. Okay, no worries. So like I said, so dialysis, in center 3 times a week, 4 hours a day. Some centers or some people need 4 times a week,
Mhm.
depending on the situation. When I worked in a dialysis center, I can tell you that it's sobering and humbling. It's a lot of things, like Sheila said, being the youngest one there, I can't even imagine. And then for me, walking in also as a young, doctor, relatively young, doctor, you walk in and you look around and you see, your patients and you know what it means. And you just hope and pray for the best, meaning like, if they're listed for a transplant, you're rooting for them. If they're not listing, you're like nagging them and trying to encourage them, to get on the transplant list. Some of them that don't have a fistula, because when you do leave with the catheter in your chest, a lot of people are hesitant to get the fistulas because they're phobia to needles, right? You're getting poked with a needle every session, to get this blood out and circulating through the machine. So you have patients who don't have the fistula or the graft, and you're trying to convince them that it's best because the catheter increases your risk for infection, which, happens a lot. It's like I said, it's for me, not being the patient, it's a challenge. So I can't even imagine on that side. I listen to their grievances. Some of them have the itchy skin. Insomnia is a big thing. They're restless. The machine's alarming. It's kind of like triggering. You're sitting there for a long time. Trying to like spend the time. Some of them are reading or trying to do puzzle, but from me looking in, I think it's an option that we have. It's the only option that we have when you have end stage renal besides transplant. So I think we make the best of it, to say lightly for the patients. I think, most patients would not want to be on dialysis if given a choice, but it's what we have.
Thank you. So with that being said, thank you for explaining it from the doctor's point of view, Dr. Leon. Sheila, can you talk about, because, like Dr. Leon mentioned, you were pretty young. So what was that adjustment like for you? I mean, you mentioned that you were going after school and, what do you wish you had known before even starting this treatment?
Oh gosh, that's really hard to say because whether you're like 17 or like 77, you not honestly cannot prepare for the dialysis world. I mean, it's hard. It's hard to try to prepare for something like that. For me, the first time around, it's like, okay, I'm tired from school. I'm in this chair. I'm tired, but I got to study for exams. Oh, I have to pick up bridesmaid dresses at the same time, and then the person next to me might start coding, and so you're dealing with the machines blaring, someone's pumping on someone's chest, and it's like, okay. Or you look over to the person across from you, and their eyes kind of go up like this, and then you see the nurses run over, and it's just like, okay. Or somebody getting sick, next to you. So it's a lot. Like back then, I dialyzed for 3 hours, and 3 hours is honestly too long for me during that time. And then like the second time around, yes, I'm older, but it's still kind of like I'm still semi the youngest person in the room again, even, when I was in my, 40s when I started back hemodialysis. And it's like now I have a husband, a house, and a child at home. And then I don't want them to worry about me.
Mhm.
you're thinking about them, you're thinking about your friends or family who are worried about you and
Mhm.
trying to take care of yourself. And, and I just want to say also, even though I had a transplant, I tell people my transplant is not a cure, it is a form of treatment. I
Mhm.
take close to 30 pills a day.
Mm.
I get my blood drawn once a month. And then I get my blood drawn sometimes twice a month to check to make sure I don't go into rejection. And so, yeah, I just want to let people know that, my transplant is a form of treatment. It's not like you get a kidney and then you're on your way off into the sunset. No,
Mhm.
this takes work. Okay. So I just want people to know this,
Yeah.
this takes work. Yes. Yes.
Mhm. Thank you.
Yes.
Kim, what was that adjustment like for you? You clearly said you didn't want to do it. It wasn't going to work. You don't want it. No parts of it. So, what was that adjustment like for you? Because you are, we live in the same city. You are everywhere.
Right.
And
Right. Right.
so, how did that even affect that? Because you are such a community advocate. How did that affect that?
So I remind my doctors every time I'm in the clinic how much I hate dialysis, just so they don't forget. Um, Dr. Leon, I love you, but I'm gonna have to say it. I hate when they say that it doesn't disrupt your life, that you can go on. The heck
Oh,
it does.
it
Dr.
disrupts
Leon
you.
said, I ain't
It,
saying
dis-
nothing like
it
that.
disrupts you. I know it disrupts your life. I know it disrupts your life.
I call her Bertha and my cousin. So me and Bertha, she's about yay big. Me and Bertha travel together if I go somewhere, and I hate her, and I almost forget her cousins half the time when I'm packing my car. So her cousins, so I had to do this, y'all, so I can remember. So her cousins are these huge bags of fluids, sugar that go in my stomach. And they make you feel like you're about 9 months pregnant during the night. So I do my treatments at nighttime every night. I'm sorry, I got one night off now. 6 days a week for 9 hours, me, Bertha, and her cousins are chilling all night long. They sing to me sometimes. They jerk my guts sometimes. Sometimes we're a happily little family, and other days I just cuss it out, but I'm still hooked up, so it don't matter. Um, so it's a process. I absolutely I have learned a lot because there's a lot that I just didn't know about the body. It is a definitely a huge education piece. And I was so sick when I first went in. So with hemo, you go through literally a week long education with nurses. You're there the whole day from like 8 to 3. They teach you how to do your own treatments. Then you come home and they come to your house with you, make sure you know how to do everything by yourself, and then they let you go so that you can do your treatments by yourself. And so, but we've also become really close because you have to have some form of trust with your team. But they have shown me, how to take care of myself if alarms go off, if things are troubled, what to do to troubleshoot. So, even though I have learned to look at it as this is helping me, this has gotten me better from where I was so sick. And I guess, Dr. Leon, like you were saying, like in my mind, I never thought about, and this is just because I am a naturally positive person. I never thought this is the end stage. Like this could be it. I never even allowed myself to think that way. It wasn't that I was trying not to. That's just what my brain, you know what I mean? Like I just fought cancer. Why would this be the thing that takes me out? So I just never thought like that. My goal was just like, okay, let's do this machine. Let's get off. Let's get a kidney. So just very like cut and dry, which clearly it's not. And just having to, it's almost the same with cancer. Like you're not in control. Like you have to succumb to the medicine and the protocols and time. And that none of that is really within your control. You either do it or you don't. And that's never going to be an option for me because I have 2 children. So does it suck? Absolutely. I will never make light of it, but it is what it is at this point.
Thank you both for sharing that. Thank you. Dr. Leon, did you want to weigh in on their stories about how it's affected them in their daily life?
I love Kim's honesty. That's what we need to hear, right? I know it's true, right? And then Sheila, just giving us the whole experience. And I forgot to mention, even as the doctor, the codes take me out too, like you were just talking to the patient. And then, like I said, cardiovascular disease and that risk is very high because, the electrolyte abnormalities, the stress on the body. So codes are very common in the dialysis units.
Mhm.
Yeah.
What I hated, I'm going to say this real quick because I'm not really on that side. So in the dialysis center, we're kind of separated. Well, in at DaVita we are. I don't know if every center is like that, but when I go in on the PD side, like our halls are separated, so I barely even see the in-center people. But if I go use the restroom, I've seen them just like maybe 3 times in the past 2 years, and it is such, Sheila, I can't imagine like just the feeling of seeing a room full of people hooked up. Because even with chemo, you're in your own little cubicle. Everybody is separated. There's a curtain, so you walk in, but you're seated, and you have your own little privacy room. And it's not like that in center, especially well the ones I've seen. I can only talk about what I've seen. And I think
Yeah.
psychologically, that's a lot. Even when walking in the cancer ward, there's a smell. And I tell my dialysis people all the time, what are you talking about? I'm like, girl, it's like PTSD for me. I call it
the bicarbonate, I think, in the machines. Yep, it's that smell. I know the smell.
as soon as I walk in that door, because that smell is a trigger. It makes me sick to my stomach. And it's just, it means it's clean. But to me, psychologically, absolutely not. And I think I wish that could be different for in-center, the way that it's set up, because that does something to you. Yeah.
And, you know, honestly, the second time around when I was, you know, starting back hemodialysis, they were really pushing for me to do home hemodialysis. PD wasn't, they didn't really offer PD to me at the time. I can't remember the reason why. They said, we think, you know, hemo would be better for you. But, you know, they said, oh, you can do it at home and this and that. And I said, I honestly had no interest in it. I had a kid, I mean, he's not a kid anymore, but like years ago, I had a younger son. I didn't want him to see that in the house.
Yep.
I did not want to put additional pressure on my husband to worry about me on this machine. I definitely had no interest in sticking myself. I definitely didn't have no interest in that. So I said, no, let me leave my home, go somewhere to be treated, to get well, and then come back. And I could just kind of leave that part of me outside the home.
Yeah.
Well,
let's be all the way real. Like, so once I got to this stage, I divorced. And so when me and the nephrologist were having a conversation before I got to the ER, me and the kids sat down and talked about it, because I knew Zion for sure was going to have a connection, because we just went through a whole situation, and, you know, hair loss, gone for stem cell treatment, like the whole thing. So I even said, when I went in for my first education, I was like, how am I going to relate with somebody? Like, have a new partner, show my body to somebody? And she like, I don't think I guess I caught her off guard, because like I was being like, for real. And she was like, you have sex? Who? Like, I'm sure it's not blocking my vagina. I'm aware of where it's at, but that's not the point. So it is a, go back to the psychological thing, right? Like how much do I want my kids to see? Of course, I'm not sticking a needle in my arm. That's that's different too. But shutting the door, still having a hard time with Harper, being like, you can't just open my door. If it's shut, that means I'm hooking up. This is what that can mean. This is what it can do. At least twice a week, I'm screaming at her like, please don't open the door. So it's still a whole lot of getting used to. But absolutely, as caregivers, they're supposed to be caring for us, but we mentally try to take that off of them. My niece fusses at me all the time, like, don't feel like you can't share because you're trying to protect us. You're taking our right away to say how we want to feel. And that's, but I think that's what we do to protect them.
Yeah.
Well, let's talk a little bit more about that mental health aspect, because like Kim was mentioning, the PTSD of even the smell, you know, worrying about your kids, but what else are you, and being in there where people are coding, how do you go to therapy? Do you journal? How do you deal with that mentally, you know, through this journey? Sheila, I'll start with you.
It took me a while to realize how I was literally going through the stages of grief, because I lost the use of my kidneys. Not once, but twice.
Right.
Like I went through the whole anger, sad, denial, the whole gamut. But yeah, it was really like going through the grief process, because you lost something, you know, that's a part of you, that's, you know, that everybody else has. But yeah, mentally it's tough, because not only am I dealing with kidney disease, I'm dealing with just everyday life, like dealing with like my parents being ill or my son being ill or something, or my husband getting laid off, or like just any of those internal factors. And on top of dealing with kidney disease, it can be tough. And at one point I did go to therapy for a while because it just took a toll on me with so much external stuff going on and internal stuff. And, my therapist helped me to realize that don't be afraid not only to ask for help, but accept help. So for example, if I get sick and I'm in the hospital, what can I do? You know what? I don't want the guys eating out all the time. I'll have a friend bring a big old pot of spaghetti and garlic bread, bring to the house. That's one less thing I have to worry about, kind of thing. You know what I mean? Like,
Yeah.
just little things like that. Or like, my mom passed away a few months ago, and my friend was like, do you need any help? And I was just like, oh my gosh, I have to deal with her will, I have to deal with estate planning, I have to deal with the funeral. And she's just kind of like, okay. And I said, you know what, can you just sit with me and help me write, thank you cards, for after the funeral or whatever. And then she was like, yep, I can sit there and help you put stamps on them and just listen to you and no problem. So, I mean, it's the little things like that, allow people to to help me and, to ask for help. So that's the one thing that I still continue to work on, trying to get better at. Yeah.
Yeah. Thank you for sharing that. And my condolences to you,
Yes.
the loss of your mother.
Mhm.
Kim, you mentioned in the last part one about some of the mental aspects that you were dealing with, because like you said, this is like the second thing on top of already going through cancer. And you and I talked at length about the cancer before, but what does that do to you mentally? I know you said you were very like, okay, this very like cut and dry, this, but what have there been moments where you're just breaking down and you're like, I don't know.
Yeah, right.
Yeah.
Absolutely. Absolutely. I have those days where I'm just like, so part of me is like, it's so heavy, it's so unfair. But then like the God part of me is like, why not you? So I've never said why me, but I have said this is unfair to go through something else. Yeah, it gets heavy. There's days for sure. There's days when, like she said, all the life stuff jumps on top of it. And then you just kind of, I think the best thing is just to sit in it. You have to just sit in it and to get through it and then pick yourself back up off the floor and keep on moving. And that's what I've kind of realized is what I have to do to push through. But I do think, and I've said this, I think I said this last time as well, for real, it's because of my kids. It's because I've lost my mother and my father is there in Tennessee by himself. Well, not by himself, my brother is there, but because I know he worries. Like he called me the other day and I don't know what he heard, what he read, what he saw, but he was just like, Kim, are you okay? And I'm like, yeah, what's wrong? I'm thinking something's wrong with him, but he's probably thinking something's wrong with me. And so, trying to stay strong for my outliers. I don't feel like I have the opportunity to fall apart, if that makes sense.
So. It does. Dr. Leon, from the doctor's perspective, what advice can you give to those that may be mentally going through it, knowing that they're on this dialysis journey and they may need a transplant at some point? What advice can you give them? And also if you want to share again your perspective, how mentally seeing your patients that you're attached to going through this.
Yeah. No, even, today, just listening to Kim and Sheila delve deeper in, I'm an empath. That's just who I am. Okay. So it's hard. And again, Sheila, condolences to you, your loss of your mom. But yeah, so emotionally, like I said, I'm an empath. I feel for my patients. I love my patients. I do the tough love in the clinics whenever you interact with me. But it can affect us also. But what I think and feel is that everyone should be in therapy, or everyone should have an outlet where we self-care and practice wellness and mindfulness and all that, because life, like you just said, is hard, period. And then you get a diagnosis, right? And I think majority of people with chronic diagnosis are depressed. and they have unacknowledged, undiagnosed, like true diagnosed depression. I think also when you first get a diagnosis, there's an adjustment period. So there's like, so there's all of that. So I feel and I believe that patients have to understand that it's okay to not be okay, right? It's okay to be angry. They get angry with me. I'm like, good. I hear you. Like I'm not taking offense. Like I would be a little worse than you, maybe. Like, all right. But so I think it's okay. Patients need to know that it's okay to not be okay, and they should feel that their physician or their team should be someone that they can honestly share with. Like Kim says, I hate dialysis. Yes, I should know that. Right? As your doctor, right? I should know that. I should know honestly how you feel about it so that we can, hold hands together and, scream and do whatever we need to do, but help you understand that we need to do this dialysis. Same thing with the meds, right? Like, why so many meds? I explained to you, this is why you need all these meds, right, Sheila, with the, transplant drugs, right? Can't miss any of those, like can't, you got, we got to use little tactics, with my patients. I'm like, I'm programming their phones with alarms. I'm like, listen, you have this wonderful phone here that does all these great things. Do you know you can do this on here? Stuff like that. So yeah, so I think, we have to find ways to partner and work with your medical team to take care of, of your health.
Thank you. Yeah. I'm sorry. It was like glitching right there for a second. Did I step on anybody? Sorry. Okay. Sheila, I wanted to ask you, because I know we're running out of time, but can you share the difference for you, or if you notice a difference of having a living donor for your kidney transplant or having a deceased donor?
Well, the main difference, I guess, for me, my living donor, I received that kidney in my early 20s.
Right.
Versus when I had my deceased donor in my 40s. And so just the recovery is different. Like in my early 20s, I felt pretty good sooner than I did when I was, a few years ago. I definitely felt my recovery was a little bit slower, like when they were trying to like get me out of bed to walk, and I'm just like, in my 20s I was just like, yeah, okay, I think I could do it. In my 40s I was just like, please, no, I'm not ready to walk yet. They're like, no, you have to get up and you have to walk. And so that's like really the main difference. And I don't think it's because one was a living, one was a deceased donor. I think it was just like the age difference and what my body been through over the years, how my body responded to that. So
okay,
yeah, I think it was just like the age thing, but not necessarily the difference between the living and the deceased donor.
Okay. Now, Kim, are you on the transplant list, or am I being too nosy?
Please be as nosy as you want to, as long as there's a kid on the other end of that. So I am listed here at Atrium. So basically all of my doctors are here. So Atrium, I just had my visits last week at UNC Chapel Hill and at Duke. I feel really good about Duke, so I hope that comes to fruition. I was listed in Nevada, but our insurance does not carry, and I'll tell you why about Nevada in a second. And I'm listed in Nebraska, and I'm supposed to go there this month sometime. So the reason, and actually I haven't started, but my surgeon here told me to get listed with Charleston and with Jacksonville. So it's all about numbers. It's a numbers game. So not only been outside of our 250-mile radius, how they share the donors or share the organs, but it's about if I can look at the stats for another hospital to see their window of opportunity or how long I'll stay on the list, then that gives me the advantage of listing with another institution. As long as my insurance will cover it, I can list with another hospital to be placed on their list. And so Nevada and Nebraska both have really good programs and very good survival rates. That's even as important as the number of transplants they do throughout the year. And so those two were pretty magnificent. And so I listed with them because of that.
Thank you. So I guess you guys would say definitely check the on your license that you want to be a organ donor, right? I mean, we're seeing what the importance is right here.
Yes,
sure.
you know, and if I can speak to that, you know, here in Metro Detroit, where I'm at, you can drive 15 minutes and you will more than likely hit a dialysis unit. It's really bad here in Michigan. You know, it's almost 3,000 people waiting for organ transplants, and I know there's a lot of myths in our community
Mhm.
about organ transplant, like, oh, if something happens to me in the ER, they're not going to save my life. They're going to try to take my organs and give it to somebody else. It's like, well, why would they sacrifice you for another person? You know what I mean?
Right.
Or
Yeah.
yes, unfortunately, yes, there is black market organs, unfortunately, but we shouldn't use that to punish those who are going about it the right way, so to speak.
Mhm.
And you know, and honestly, some people just don't want to think that they not going to be able to have an open casket if they donate anything. And it's like, do you know what they do to your body once you pass away? By the time they put you all back together in a casket, get your casket ready. And so, yeah, so there's a lot of myths in our community. And, you know, I hope I can educate people when I tell my personal story, especially my husband being a liver donor. Like, he's fine. He gets checked out with his, you know, primary care doctor. They monitor his kidney function. He's fine. He ran half marathons and such. Like, he's okay, you know. But yeah, some people just don't even want to think about signing up on their license and it interferes them. So hopefully I've touched a few people to reconsider, like, you know what, I think I should, you know, maybe consider signing up to be an organ donor, because there's a lot of us that's on the dialysis machine. There's a lot of us that's on that transplant list.
Yeah.
I'm a donor.
Dr.
I have my license now.
Oh, yeah. Yeah. Dr. Leon, I know real quick, but I wanted to ask, how can we also, you know, in addition to encouraging Black people to change their license to say they would be an organ donor, but how can we also encourage more Black individuals to participate in clinical trials for research related to kidney disease? Because I know there's a lot of mistrust around, you know, clinical trials. So do you have any tips on encouraging people like to be open to it?
Right. So that's the mistrust. It's number one. You know, it's there in the clinic room, it's in the hospital ER, it's in, you know, it's in the hospital. Once you walk in, we have a lot of mistrust. So I think the first thing is open, honest communication. You know, again, so let me back. So May 20th is actually Clinical Trials Day. So that's what I try to do. I just try to like give information, right?
Yeah.
So then, you know, people can Google, you know, Clinical Trials Day, and then you can find, you know, information about clinical trials and how to participate in clinical trials. But yeah, so I think information, education is number one, right? The more you know, like Sheila said about debunking those myths, right? The better you can be informed and you can make, you know, decisions for yourself, right? Not everyone can participate in clinical trial. Not everyone may want to, you know, do these things, but just having the information and knowing to, like Sheila was saying, right? We are so hesitant to do certain things. It impacts us as a whole, right? So when you think about being your brother's or sister's keeper, you're like, you know what will it take if I just learn about this and see if it can impact the future, right? The future of my people. At the same time, right now, we are in a very difficult, right, situation where a lot of funding's being cut and things like that. So I'm just very worried, and I try not to speak on that, but it's the reality is it's really it's alarming, and it's, as a scientist and as a physician, my community were very upset, frustrated, a lot of emotions, right? But for now, I think please go and look up Clinical Trials Day, right? And just and also World Kidney Day, and, you know, just educate yourself, like, you know, be, you know, not like, oh, I've done my research type of stuff, right? Like when someone's trying to tell you get a vaccine, like there's, you know what I'm saying, right? Like there's real data, right? You want evidence based, you want reputable information, not like from the, again, not to, you know, down certain groups like Facebook groups or whatever groups. It's like everyone in there has an opinion, but is it an informed, good opinion, right? You want to get information that's reliable and that's honest and that will help you rather than sometimes cause you harm.
Yeah, thank
Yes.
you. Thank you for that.
Yes, and sorry, I want to also add, it's not necessarily a clinical trial, but I'm also part of the organ transplant post-pregnancy registry. And
Okay.
so basically every year since my son's born, I give them I tell them what medications I took before
Mhm.
I had my son, what medications I took when I conceived, what medication I took afterwards. And I talk to them every year, what medications I'm on now, how's my kidney function now, how's my son doing now, were there any complications with his birth, was there any complications with him in school, is there any complications with my kidney? So every year I talk to them and I give them an update so they can use that information and say, okay, if a transplant patient is considering conceiving, they said these X amount of patients were on this medication, these were the side effects, or this medication absolutely no one can take if they're pregnant. So I think that was also important because it's very rare for someone post transplant to have a child, but at least that research is there so doctors can better say, okay, these are the medications you're on, you need to be at these levels to make sure you have as smoothest pregnancy as possible in delivery.
That's wonderful.
Yeah, I swear we need a part 3. This has been so good. Like I'm like, I keep looking at the time like, no. I still didn't even get through half my questions because I was so into y'all's stories. Yes, yeah. Thank you guys so much. But I want to wrap this up. What message do you want the viewers to leave this from watching this powerful panel? Because and I really believe that the storytelling of your experiences is the best way to advocate and get that awareness out there. So Dr. Leon, I'll start with you. What do you want everyone watching to walk away with from part 2 of this series?
I want to thank Sheila and Kim for, like you said, sharing their stories and being so open and honest with us.
Yeah.
And when I, speak with them and I hear their story, right? This is Kim with a cancer, which also then impacted her kidneys, right? Nothing. She did, she just woke up living her life and this is what she was dealt. Sheila, 17. I don't even know what I was doing at 17, like to be told I have a diagnosis, right? And here she is standing strong, having gone through so much. And again, not to her doing. But now I love to speak to my patient populations that where we can do the prevention, right? We can do the controlling your diabetes, controlling your hypertension, like the things that you can control and prevent. I will never stop preaching about. We must try our best to prevent us to getting to this stage, right? Because it's alarming. The number just keeps growing and growing and growing, right? So for me, I would say educate yourself, change your diet, partner with your physician. Don't go to urgent cares for primary care, right? That's like a pet peeve of mine, right? You need to have a doctor. You go to these places for emergencies, right? Your doctor should know, oh, I have this ache. And they're like, oh, did you start this new? Yeah, like it should be a dialogue. So again, for me, I think it's, focusing on the prevention and educating yourself about the more you know, the more you can do.
Thank you. That's great advice. Sheila, how about you? What's one thing you want to leave with the audience or want them to take away from our conversation tonight?
For those of you who are, on hemodialysis or PD, hang in there. Okay. It's tough, but hang in there. That's all I'm saying. Just hang in there.
Yeah.
And for my transplant patients, also hang in there. Hang in there.
No,
Yeah. What about you, Kim?
Well, Sheila, I will say you disheartened me. I thought my days of 30 pills were over with. So guess I got to get ready for that again.
It's different for everyone else. It's different. It's different. There's no set amount of pills. It's different for everyone. So don't worry. You might be only on 10. I don't know.
Okay.
When the time comes.
Okay. One step at a time. My advice is continue to advocate for yourself. Like the doctor said, it really is a partnership. I truly believe in that. One of my homegirls makes fun of me. She was like, nobody talks to their doctor like you do. And like, he's crazy for listening to you. But he lets me, if it's a fall that I'm willing to take that's not going to endanger my life, he's like, okay, that's fine. How was that? Okay, now let's get back on track. But really having your team, you have to be able to trust your medical team. and there is nothing off the table. I tell them everything. If something bothers me, concerns me, we talk about it, because I'm depending on them as much as they are depending on me. And that's huge. And otherwise, go to Atrium Health, Living Donor, and be my donor. I'm type O, but it doesn't matter. We can figure that out.
Yeah. And again, Atrium is in I don't know if it's in other cities, but it's in Charlotte.
Yeah. Carolina's
So-
Atrium. Yeah.
Okay. Yes. All right. Well, thank you. This has been great. This was a great conversation. Thank you all for coming back for part 2. This was powerful. So thank you, Kim and Sheila. Like Dr. Leon said, thank you for sharing and being transparent and being real about, like, you know, how you feel about all of the journey and everything you've been through. And Dr. Leon, thank you again for sharing your insights and advice as well. For more information, everyone, on kidney disease, you can head over to blackdoctor.org. There's articles and resources over there. Again, thank you for joining. I see you guys in the chat. Thank you guys for your comments as well. I hope everyone has a great night. Thank you.
Thank you.
Thank you.